So we talked about bacterial diseases, we talked about developmental anomalies. Happy birthday. Oh, exactly. And now we're going to finish off with viral diseases, a few miscellaneous diseases, and neoplasia. So in general, so this PowerPoint is to talk about general presentation. When it comes to viral diseases, like my rabies dog, there are no gross lesions. You can look at the dog, you're not going to see anything grossly that's going to present. And if you do see any gross lesions, it's not going to be specific for the lesion, for the disease you are talking about. So 99% of the times, we don't see any grossly. So we have very few gross images of CNS to say we see a gross lesion. Now, microscopically is going to help you. First, you have a non-suppurative inflammation, meaning it's not going to be neutrophilic, it's going to be primarily lymphocytic, and may have some plasma cells associated with it. So the term that we use in pathology is non-suppurative. Now, why don't they just say lymphocytic? I don't know. Someone decided it's best to say it's non-suppurative. You see degeneration of your neurons. So your neurons will have if it's acute, it could be angular, it all depends on what stage of degeneration you have going on. Reactivity of the glial cells, so you might have proliferation of glial cells, so increased oligodendrocytes, glial scarring, so astrocytosis, and that sort of thing. The classic, when you write down your notes, classic microscopic presentation is what we call perivascular cuffing, meaning that blood vessels are surrounded by lymphocytes within the CNS. That is a classic. Whenever I look at the brain of any animal and I see perivascular cuffing, I may not know what the viral etiology is, but I know it's not bacterial. I know most likely it's going to be viral etiology. So it's important to know, we're not going to memorize all these different diseases. We're going to know grossly, we typically don't see anything, and microscopically, this is what you see, and especially the perivascular cuffing. So this is an H&E section of the brain, and we're looking at multiple blood vessels. Maybe one, it might be coalescing, it might be just one. And we're looking at the cuff, the perivascular cuffing of lymphocytes in the parenchyma. If you look at the associated neuropile, you do see increased cellularity, and that's due to the increased number of glial cells. It could be astrocytes, it could be oligodendrocytes. It's hard to see on this magnification. So this is a very important slide to remember because it sort of helps you remember all the other viral diseases that we are going to talk about. So here's a sort of a list of some of them that we'll look at. We're going to start with equine encephalomyelitis, and there are 3 types: Eastern, Western, and Venezuelan, and it's caused by an arbovirus, and you know the vector is mosquitoes. See that guy here, he's got flies chasing him. The clinical signs are non-specific. So the animal could present with fever, he may be ataxic, dementia, increased heart rate. So we talk about microscopic lesions. Those lesions I just mentioned above are going to be more severe in the gray matter. So another thing to remember, if you're doing the tables for these diseases, it's important to indicate, is it gray matter specific or is it white matter specific or a combination of both? So we do get a polioencephalomyelitis and perivascular cuffing, as I said, lymphocytes, but we can also get macrophages. Now it does say neutrophils. Neutrophils are only seen in one type, in the early stages of EE. That is a very, I would say pathognomonic, but significant presentation of EE that helps you differentiate it from the other 2 encephalitides. We also see neuronal degeneration, and that's also a prominent feature in this disease.
So not
not VEE or a WEE. You will see lymphocytes and macrophages in all three, but specifically triple E, the eastern form, is the one that you see in neutrophils in your early stages of the disease. So if I see that, it's really not necessary for me to send it off for virus isolation, because I have an idea that it's most likely the eastern form of the disease. Why do we say the term polioencephalomyelitis? What does polio usually make you think of? Versus leukoencephalomyelitis. Those are two terms usually. So polio means gray matter and leuko means white matter. So when the gray matter is primarily affected, is polioencephalomyelitis. And if the gray matter is affected, the white matter is affected, is leukoencephalomyelitis. West Nile virus, you should have done this again. Very similar in presentation. They may be depressed, they may be ataxic. And this one also, it causes a polioencephalomyelitis with a lymphocytic infiltrate. So, horses can get both disease. How can you differentiate them clinically? I'm sorry? Clinically, so when they come into the hospital. Yes?
What would your, you talking about the difference between West Nile and East Nile?
You mean Eastern?
Eastern, yeah.
Yes, yes.
The one with Eastern, you see the teeth grinding?
You can see that with really any CNS sign. So the answer is a really bad question. You cannot. How would you treat them? But before you just say end the story, you might want to do some supportive care, maybe little fluids, make them as comfortable as possible. But yes, there really is no specific treatment, it's more supportive. But just, oh, why are the TVs not? No, why didn't anybody say that? Thank you, Christina. Anybody? Turn on the back, please. What about these two? Are they on? I can't see. I'm sorry about that. Right, so you treat them the same way. It really doesn't matter what the diagnosis in terms of the actual etiology. They're going to present with CNS signs and you treat them as best as you can. You want to narrow out other etiologies that are bacterial where you may be able to treat with antibiotics, but the minute you suspect is viral, these animals are usually euthanized and sent for testing. So you can't differentiate the two. They have the same clinical presentation. Yes?
Are there vaccines for both of them?
Are there vaccines? Yes.
There's West Nile. Is there?
Eastern, yes, there is. Now, I'm not sure if all states vaccinate for all three. They do. They do. Johnson and Shaken too.
I know Alabama, they're requiring to have, if it's going to go out of state, has to have Eastern, Western, and Venezuela.
Okay. Because I know in the South, obviously, we have more of an infestation with mosquitoes than maybe higher up. But thank you for that clarity, because I wasn't aware of that. Any other? Yes, Lori.
Just a clarification. Are we talking about you can't differentiate Eastern and Western encephalomyelitis or Eastern and West Nile?
So we can't differentiate any of those encephalitides in terms of Western, Eastern, Venezuelan, one area, versus West Nile. They all present with the same CNS signs. So all those encephalitides, it's hard to differentiate them. Okay. Canine distemper, that's another disease that is caused by a paramyxovirus. And how does canine, what are the different areas that canine distemper affects? GI, so gastrointestinal, what else? Respiratory. Skin, very good. Obviously CNS. So yeah, so it can affect multiple areas. It's not just one specific in terms of organ systems. One of the things that is very characteristic of canine distemper is the demyelinization. So we talked about, when we first started talking about the CNS, some diseases cause loss of myelin, and this is one that is pretty significant when you look at it microscopically. It affects both the brain and spinal cord, but it's very severe in the cerebellum. So again, what clinical presentation do you expect to see in these animals? Where's Sheridan? You're not doing it like last time.
Okay.
Yes, like that.
Stressed.
You're stressed. Are you worried about this test this afternoon?
Yeah.
Of course.
Every other one that comes for the next 3 weeks.
All right, this is a dog with distemper.
ต้องการดูต้นหน้ามาตรงนี้นะครับสายดี
Vaccinate your animals.
I know. Yeah. There are a lot of videos out there. Oh, let's keep going. Okay, so that's canine distemper. Fall cholera can also give you CNS signs, and the etiology is a pestivirus. We know it's also known as classical swine fever. Besides the CNS signs and CNS involvement, you can get petechiation in the kidneys. So what did we say petechiation in any organ system is usually associated with? Viruses, but what is the general term? DIC, right. So we can see areas of petechial hemorrhage in kidneys, peripheral lymph nodes. Those are the two areas that we predominantly saw that. When I got to Plum Island, I would get like really excited when I think about the trip. There was a lot of hair washing. That's one thing I remembered. We actually had a case of they infected a pig with pestivirus, and we saw the progression of disease. It is pretty remarkable. So yes, they presented clinical signs in terms of CNS signs, and they started within, I would say, about a week, because we were only there for 10 days. They usually euthanize these animals so that we can do necropsies on them. So it's like it's an amazing experience for people to see the clinical presentation, and also for pathologists to see the internal lesions. So they had the lesions in the kidneys, and one of the things that's highly diagnostic of cholera is infarctions in the spleen. So this is the spleen, right here. This is the normal area of the spleen, and at both poles of the spleen, we have enlargement or necrotic, sort of dead or dying tissue, and that's due to infarction. So what other disease we see in pigs have a similar presentation? So it's not classical swine fever. What's the other one? African swine fever. So it's hard to differentiate the two. With classical swine fever, you get the splenic infarcts. With classical swine fever, you see the splenic infarcts. With African swine fever, you see marked splenomegaly. So you have enlargement of the spleen. Now, obviously, you don't want to use that as your only criteria. You want to do diagnostics to rule out this disease. Another thing you see besides the CNS signs is hydrocephalus. So we do have that accumulation of the CSF fluid within the brain of these animals. What else do we see with hog cholera?
Turkey egg.
Turkey egg. Very good. Yep, you got it. Rabies, my least favorite topic. Yes, you have a question? Oh, someone's just talking. Okay.
They said Lysovirus.
Yes, very correct. The reason I say, I think about 5 years ago, I actually thought I had rabies. Don't laugh, it wasn't funny. There was a fox that came in, and I didn't think about it. I just, take the head off, send it off to the lab, and the guy calls from the lab, and he has this very monotone, like if it's positive or negative, you couldn't tell because he's not really excited. He said, Dr. Casimir, the animal is positive for rabies. Have a good day. I'm like, oh, okay, that's lovely. And so I go home, and you know how your mind messes with you? I try to drink some water in my throat. I couldn't swallow, and I'm like, I'm gonna die alone. I start coming the next day, and I tell Dr. Gorham, and he just starts laughing at me. And it was a very humbling experience. Dr. Webster, if anybody knows him, he did rabies then, the rabies titers, and I literally cussed him on the phone because he said, can you wait till next week to get a booster? I said, if I die by tomorrow, I'll wait till, but I see I'm still here, and so it's all good. Anyway, rabies, you see them really in multiple species, skunks, foxes, raccoons, a lot of wild animals can be infected. We had a horse once that was infected, and he came in for umbilical surgery. They had no idea he had CNS signs. He came in, and then right after surgery, he started like acting weird, and so Dr. Gilbert was on, and I said to her, well, what if he has rabies? He had rabies and exposed to half of the senior class because, you know, they did the aftercare. So it's you never know what rabies looks like. So I always say it's the rabies that you don't know that you should be worried about. That's why I make sure that all of you are vaccinated, and next year, as third years, you will get titers done and boosters if your titers are low, because I'm a little paranoid when it comes to rabies. And I'm sure everybody heard about that little boy in Florida. That was a horrible story. So if you hadn't heard, his dad found a bat and he took the bat home and said to his, 4-year-old, don't touch the bat. I was like, okay, I have an 8-year-old and tell him. And the little boy touched the bat, got bit. They didn't take him to the hospital because he said he didn't like shots. So they kept him home. And by the time they took him to the hospital, it was just too late. So that is a horrible, tragic story. But rabies is not a joke. Someone had a couple of questions. Yes. Naima? You know, I don't know. They did a presentation during a symposium, and it's, why? What are you
Their
doing?
temperature's too low.
There's some pictures?
Their temperature's too low.
That's right. That's what he did say. He did, so Christina just answered. They have a lower body temperature, so the virus can't replicate. But I do remember him saying that. So possums typically, well, they are resistant to rabies. Yes, Lori?
Administrative question, is the booster/titer gonna be covered by the insurance?
It is.
Okay.
We are the only school, and God will let us keep it going, because I don't know how we got through with that, but, you know, and every year they complain, well, this is costing too much to do it. But the titers will be covered by us, and the booster, if you need a booster, it's covered by us. Right. Microscopic, we see, again, non-suppurative encephalomyelitis with inflammation of the ganglion or ganglionuritis. And remember, where does rabies usually like? It likes to stay in your salivary glands. So it's spread by bites and that sort of thing. An open wound. So you have to have an open wound for it to spread. You do see perivascular cuffing, glogliosis, which is proliferation of glial cells, and neuronal degeneration. The thing that stands out by rabies is the neuronal intracytoplasmic inclusions called Negri bodies. And this is important to know, in carnivores, you see them within the hippocampus. So if I give you a section of brain, and I say, where would you expect to find those Negri bodies for a dog? I expect you to know that it's in the hippocampus. So don't submit a section of something else for that if you're looking at it microscopically. Now, for herbivores, it's typically found in Purkinje cells. So it's important to know the difference between herbivores and carnivores. Why? I don't know. I saw your face, Brandon, like, why? I don't know. That's just typically how it is. It's just one versus the other. So, let me show you a video. This is a deer. So if you, for my hunters out there, who hunts? Okay, be careful now. You'd be like, oh, this is an easy animal to get, but this deer actually had rabies after they submitted the brain. And that's a very telltale sign. They call it bellowing or sort of like a crying noise. We see that a lot in cows.
First time that I heard his name, I thought it was Scott out in the woods.
She left.
Is that his driveway?
What?
Is that his driveway?
Yes, driveway. And that's another sign. When they're way more friendly than normal, I would stay away.
Being clown.
So, ooh, there's a cat rabies. So you have to be careful. Yes.
So once, it was last summer, I saw a deer that was just like dead in front of a house on the side of a pretty busy road. And I called the sheriff's office to tell them, hey, there's this deer. Someone should probably come get it. And they laughed at me. How do you report that? Because I don't know what killed it. The guy's like, what, do you want somebody to kill it? Like make sausage out of it? I was like, no, I want someone to come pick it up.
You can call game warden.
Game warden.
They
Yeah,
have
I know that.
and everything.
Now this is the typical Cujo kind of presentation we see with animals with rabies.